Welcome to YouTube channel HealthQ, the place where my mission is to motivate you to look at the brighter side of the health. I'm your host, physiotherapist Meghna Dave, and let's talk today about sin kinesis. The most commonest asked question about sin kinesis is sin kinesis curable? So I'm going to try to answer this question in this video. So make sure to watch this video till the end. So let's begin. Well, before I tell you whether the sin kinesis is curable or not, it's very important for you to understand what exactly is sin kinesis and why does it happen. So sin kinesis basically stands for a movement that happens together. Okay, so where here sin means together and kinesis means movement. Sin kinesis, when these two words combines, the meaning that forms is movement that is happening together. Now it's one of the most commonest sequelae or else complication of Bell's palsy. In sin kinesis, what happens is when there is an involuntary movement of one side of the face or else one part of the face is happening, there is also an associated involuntary movement that happens, and that is only called as sin kinesis. So for example, when someone who is suffering from Bell's palsy or has suffered from Bell's palsy, after a certain time they will start experiencing that when they are trying to smile, their eyes are getting smaller, or else when they are blinking, the mouth is also moving. So when these kind of experiences are happening, there are chances that you are having sin kinesis. So the first and most important thing that we should understand is why exactly does sin kinesis happen. There are three reasons due to which sin kinesis can happen in Bell's palsy. The first one and the most popularly known one is aberrant renovation, which means when your facial nerve is kind of regenerating post Bell's palsy, it kinds of branches out and starts supplying to other parts of face as well, which leads to sin kinesis. That's the first commonest hypothesis or else commonest cause for sin kinesis. The second reason why sin kinesis happens is epiphytic transmission between the axons. What do I mean by this? Whenever a nerve or else a nerve cell gets excited, at that time there is exchange of ions that happens between two nerves, and this exchange of ions sometimes also happens between the adjacent nerves as well, due to which this excitement leads to sin kinesis. And the third reason is hyperexcitability of the nerve itself. So when the nerve which is recovering from Bell's palsy starts getting hyperexcitable or else irritable, at that time also sin kinesis develops. Mostly the people who are having second or else third degree of Bell's palsy are at higher risk of developing sin kinesis than for the people who are in first degree of nerve injury, which means the mild form of Bell's palsy. Whoever have mild episodes of Bell's palsy, they will not land up with sin kinesis, but the people who have got severe form of Bell's palsy, they are at higher risk of developing sin kinesis. But the good news is, apart from that, there are also patterns that are seen in sin kinesis. Everybody don't have same type of sin kinesis. Sin kinesis also shows certain pattern. First and the most commonest pattern is oral to ocular sin kinesis, which means whenever you are trying to move your mouth, at that time there is synkinetic experience seen in the eyes, which means whenever you are trying to smile, for many people the eyes kind of get smaller or else it completely closes down. So this is called as oral to ocular sin kinesis. The second type of sin kinesis is ocular to oral sin kinesis, which means whenever you are trying to move your eyes or else eyebrows or anything that's above the nose level, that movement will lead to mouth movement. For example, when you are trying to blink your eyes, there would be an automatic movement of the mouth muscle. So that is an example of ocular to oral sin kinesis. Sometimes there is ocular or oral to mentalis sin kinesis, which means whenever you are trying to move your eye or else forehead muscles, at that time there would be movement experienced in the chin. And in some people, when they move the mouth muscle, they will experience some sort of contraction involuntarily happening in the chin. So the oral or ocular to mentalis sin kinesis is also the third common synkinetic pattern. And the fourth common synkinetic pattern is in neck synkinesis, which means whenever you're trying to do some oral movement, when you are chewing your food, or else when you are talking, or else you are doing some facial movement, at that time you will feel some kind of involuntary movement happening in the neck muscles. So out of all this, the first two synkinetic pattern, which is the oral to ocular synkinesis, which means when you smile your eyes automatically get smaller, and ocular to oral synkinesis, which means when you blink your eyes, or else when you raise your eyebrows, or when you frown, at that time your synkinesis or else involuntary movement in your face happens. So these are different types or else different patterns of synkinesis. And now coming to the point, as if whether the synkinesis is curable or else reversible or not. So I would like to give the answer not in a straightforward way, but I would like to tell you this thing, that synkinesis is to an extent preventable, especially in the people who have got second degree of nerve injury. So if your nerve injury is at moderate level, if you are having recovery seen after 2 months or 4 months, between that period of time, even though it's a kind of milder recovery or a slower recovery, still if you are recovering, you are at a higher chance that you can prevent your synkinesis to happen. But mostly people in this stage get synkinesis because they do certain mistakes like overdoing of facial movement, taking electrical stimulation for a long time. These kind of things can lead to synkinesis in people. But if you are careful in doing your maneuvers, your exercises exactly in the way that is correct for your facial muscles, you can prevent synkinesis. But if you have got third degree of Bell's palsy, where for almost over a year has happened, but there is zero recovery or else no recovery, or is a very delayed recovery, say somewhere around 7 to 8 months, in those cases, yes, you are at higher risk of developing synkinesis. But still, the synkinesis, even though might not be completely cured in the severe cases, it can be controlled or else it can be minimized to a lot of extent. So how much this synkinesis will improve depends on what level or also what degree of nerve injury has happened in a patient. Apart from that, how much severe is your synkinesis? For some people, the synkinesis is so severe that even when they are resting, when they are not moving their face, still there is some involuntary contraction happening. In those cases, the aim of the treatment is to try to minimize that and bring it to the moderate level. But we cannot expect 100% recovery in those cases, because along with synkinesis there is an actual nerve damage that has happened. There is a lot can be done in terms of improving the synkinetic movement, improving the severity of synkinesis. So when we treat a patient with synkinesis, our aim is to first identify how much severe is synkinesis. Mostly we divide the patient or else classify our patients into 3 categories: mild synkinesis, moderate synkinesis and severe synkinesis. Mostly the people or else the patients who have got mild synkinesis and they are identified or as they have observed their synkinesis in early days itself, it becomes much easy for us to help them, and then with the help of right exercise program they can completely reduce their synkinesis. But if this problem is taken care of or else is sorted later on, the synkinesis gradually increases and then it might become difficult to completely reverse the synkinesis. Now, when it is a moderate level of synkinesis, yes, to a lot of extent it can be reversed, but you will always see some level of discrepancy. Yes, synkinesis will reduce very drastically, but yes, your facial muscles might not be the same as those were before Bell's palsy. So there would be some sort of discrepancy or some sort of facial muscle weakness or some difference in the facial strength that you will see from the affected side and the non-affected side. And the third and the most severest form of synkinesis, in that case the intention is to make or else minimize the synkinesis to the point that it becomes very mild to moderate level. Now the management of this is done with the help of method called as neuromuscular re-education, mime therapy or else EMG biofeedback. There are multiple formats of exercises, different school of thought that are being used in order to manage synkinesis. and usually you have to give a time of 1 year to see some sensible results in your synkinesis reduction. Yes, unfortunately till date there is no quick fix or else no cure that has been directly invented for managing Bell's palsy. The aim is to break the habit of doing involuntary movement, increase the awareness of the facial muscles, teaching patient to do the facial movements in an isolated way. These all exercises, when done in right pattern, identifying it to what extent it is, so when done with a good professional help, it helps in recovery, and yes, you will see some good amount of improvement in your synkinesis level. So I hope I tried to answer your question, your confusion about whether the synkinesis is curable or not. If you found this video helpful or as informative, make sure to share that in the comment section below. Also, don't forget to like, share and subscribe to HealthQ channel.